Welcome to Fertility Doc Talk. I'm your host, Dr. Kaajal Abrol. I'm a board-certified obstetrician-gynecologist and fertility physician based in Toronto, Canada. My goal is to educate patients, partners, and the public on fertility and to destigmatize infertility. Through this podcast, I aim to increase knowledge and awareness about reproductive health to empower people to make informed decisions about their own fertility. Welcome everyone. In this episode, we are discussing egg freezing. Egg freezing, also called oocyte cryopreservation, is a great fertility treatment option for individuals who are not actively trying to conceive or ready to start a family now, but wanting to preserve their fertility for the future. It gives people a bit more reproductive flexibility, meaning the ability to have increased chances of pregnancy later in life, when pregnancy rates decrease due to the impact of age on egg quality and egg quantity. Egg freezing has gained a lot of attention in the media in recent years, but there are still wide gaps in knowledge about fertility and about egg freezing itself. So let's talk all about egg freezing and understand what it is. How does egg freezing work? What are the different medication protocols used for this treatment? What are some of the pros and cons of egg freezing? These are all great questions, so let's dive in. I think a discussion of egg freezing should start with some of the common indications. Personally, I like to divide indications up into medical or non-medical indications. Medical indications include medical treatments that may significantly impact future fertility, such as chemotherapy or gender-affirming surgery. Non-medical indications include the many reasons why someone may not feel ready to try and conceive now, such as being focused on education or on career or professional goals, or having the desire to wait for the right partner before starting a family, or just feeling like the timing to do this on their own is not right. If you are starting to think about egg freezing and whether it is right for you, the first step in the process is seeing a fertility specialist to review your medical and lifestyle history and complete some initial testing. When discussing ovaries and eggs, age is probably the most important factor to discuss and consider. This is because an individual with eggs is born with all the eggs they will ever have, and as they age, these go down in quantity and quality. This decrease occurs more quickly in the 30s, especially after age 35. With this more rapid decline in egg quantity and quality, there is a more significant decrease in pregnancy rates and increase in miscarriage rates. Egg quantity, also known as ovarian reserve, is assessed using a group of tests called ovarian reserve tests. These include 3 key tests: a day 3 FSH level, a day 3 antral follicle count, and an AMH level. A day 3 FSH, or follicle stimulating hormone level, is a hormone measured with a blood test. FSH is the hormone that comes from the brain and signals the ovary to grow and mature an egg every cycle. A day 3 antral follicle count is an ultrasound assessment of the ovaries. The number of immature eggs that come from deep within the ovary to the surface of the ovary every cycle are counted by measuring the number of small antral follicles sitting on the surface of the ovary early in the cycle, usually day 2 to 4. How many eggs come to the surface of the ovary at the start of a cycle is generally a reflection of how many eggs are within the ovary. An AMH, or anti-Müllerian hormone level, is another hormone measured with a blood test. It does not have to be tested early in the cycle, as with FSH. It can be tested at any time in the cycle. This hormone is produced by the follicles housing the immature eggs in the ovaries. So the more AMH in the blood, the more eggs in the ovary. While ovarian reserve testing can be very helpful for discussions of family planning goals and treatment planning and prognosis, they also have limitations, and it's important to understand these. Ovarian reserve tests do not tell you if you are fertile or not, and whether you can conceive naturally. They also do not tell you exactly how many eggs you have, or exactly how long you have before your fertility is significantly compromised. And they do not tell you about your egg quality. What they do is give you a sense of your egg quantity. meaning whether your egg quantity is average, above average, or below average for your age. They also give a sense of how you will respond to fertility medications that are used to stimulate the ovaries in an egg freezing cycle. Egg quality refers to whether or not an egg has a normal number of chromosomes. Chromosomes are DNA molecules that hold all your genes, all of the genetic information for your body. A chromosomally normal egg has 23 chromosomes. Age is the main factor that affects egg quality. As an individual with ovaries ages, the number of eggs with an abnormal number of chromosomes increases. In addition to age, other factors that may affect egg quality include lifestyle factors, such as smoking or recreational drug use like marijuana, environmental factors, such as exposure to plastics, medical conditions, like endometriosis, and medical treatments, such as chemotherapy or radiation treatment. At this time, there are no specific tests to predict or test egg quality. Age is the best indicator of egg quality that we have right now. Age, combined with a review of lifestyle and medical history, will help to predict egg quality issues. So once you've seen a fertility specialist and had ovarian reserve testing, you may decide to proceed with egg freezing. So let's understand what that involves. The egg freezing process can be broken down into 3 main steps. First, the ovaries are stimulated with injectable fertility medications to grow and mature a number of eggs over the course of about 8 to 14 days. These medications include FSH hormone and sometimes also LH hormone. Another injection is also used to prevent ovulation, so the maturing eggs stay inside of your ovaries. This process of ovarian stimulation is monitored with serial blood work and ultrasound done every few days to look at ovarian follicle growth and blood hormone levels. This is called cycle monitoring. As the follicle grows and the egg inside of it matures, the estrogen level in the blood should rise. Once ultrasound and blood work results look appropriate, a final injection called a trigger shot is given. It helps to complete the final step in maturing of the eggs and triggers ovulation to occur. Before ovulation occurs, the second step is completed, the egg retrieval procedure. The egg retrieval is specifically timed, usually 35 to 36 hours after a trigger shot, so that the eggs are retrieved just before ovulation will occur. During the egg retrieval, sedation medications are used to make patients comfortable. Then an ultrasound is used to visualize the ovaries and the follicles, while a needle is passed through the wall of the vagina into the ovaries, which are sitting just above the vagina in the pelvis. The needle is used to drain the fluid from the ovarian follicles. The fluid is then assessed under a microscope to find the eggs. The third and final step is freezing the eggs. All the eggs retrieved from an egg retrieval procedure are assessed under a microscope to identify the mature eggs. These are the eggs that can be fertilized by sperm. In an embryology lab, a specific set of steps are completed to carefully freeze the mature eggs for future use. This hopefully gives a good sense of the egg freezing process. So let's now move on to learning more about egg freezing, like the basic medication protocols that might be used. Each egg freezing protocol may start with stimulation around day 3 or 4 of the menstrual cycle, or it may start with some pre-treatment, where a medication or more than one medication are given prior to the stimulation medications to help the ovaries respond appropriately. This pre-treatment is often called priming. Oral contraceptive pills, which I like to call the pill, are commonly used as pre-treatment. The pill allows physicians to time cycles to avoid specific dates or certain days of the week. They also suppress the ovaries to reduce the presence of cysts that might be seen at the start of a cycle. And lastly, the pill helps to synchronize follicle growth, meaning the pill quiets the ovaries down before stimulation to try and get a larger group of follicles growing at the same pace, thereby increasing the chance of getting more mature eggs from an egg retrieval procedure. Other possible pre-treatments may include estrogen alone or a combination of estrogen and androgen. Both of these are often used in patients with lower ovarian reserve because they are felt to suppress the ovaries less than the pill. They have also been shown to help synchronize follicle growth and get more follicles to grow in individuals with lower egg reserve. There are 3 commonly used medication protocols for egg freezing. 1. A long loop-on protocol, 2. An antagonist protocol, and 3. A flare or microflare protocol. In an egg freezing medication protocol, there are 3 general types of medications used. 1. A medication to suppress the LH surge in ovulation. 2. An FSH medication, and also often an LH medication, to help stimulate the ovaries to mature a number of eggs reflected in growth of the ovarian follicles. And 3. A trigger medication, which is a medication used to stimulate the final maturation of the eggs before egg retrieval. Sometimes even 2 trigger medications are used in certain protocols. In a long Lupron protocol, Lupron, or a similar medication, is used to first suppress the ovaries so that ovulation does not occur later on, once the eggs start to mature and the follicles start to grow. The stimulation medications are then added to help the eggs actually mature. In an antagonist protocol, the stimulation medications are started first, and then once follicle growth is noted, the antagonist medication is used to suppress ovulation, as it has a more immediate response and doesn't take a lot of time to suppress the ovaries like Lupron. In a flare protocol, the stimulation medications are given at the same time as the suppression medication. The suppression medication first causes a flare of the body's FSH and LH, which together with the FSH and LH medication given will hopefully kickstart the maturing of eggs. A long Lupron protocol is often used with patients with normal or average ovarian reserve. An antagonist protocol is quite versatile and probably the most widely used protocol right now. It's good for patients with low ovarian reserve, but also those with normal or high ovarian reserve. A flare protocol is ideal for patients with lower ovarian reserve. Let's continue down this path to learn more about egg freezing and review some of the potential risks or side effects of the treatment. There are side effects of the medications, including injection site reactions like bruising or itching, bloating, breast tenderness, mood changes or mood swings, or headaches. There is also the risk of ovarian hyperstimulation syndrome, or OHSS, where the ovaries are so overstimulated that there's a variety of symptoms that may occur because of this, including significant abdominal pain or bloating, fluid buildup in the abdomen, diarrhea, vomiting, dehydration, and sometimes even an increased risk of blood clots. This is more of a risk in patients with higher ovarian reserve. There are also complications from the egg retrieval procedure, including infection, bleeding, or injury to nearby organs like the bowel or the bladder. These risks are very uncommon, although they are good to be aware of. It seems natural to now talk about success rates from egg freezing. This is not a simple subject to discuss, as many factors influence success rates from egg freezing. Most importantly is age of the eggs and ovarian reserve. Age of the eggs is correlated with egg quality, and ovarian reserve will determine how many eggs you may get from an egg freezing cycle. It's important to review and understand your ovarian reserve results and your expected prognosis with your physician, so you go into an egg freezing cycle with realistic expectations. As great as egg freezing is, it is important to understand that it does not guarantee a future pregnancy. That said, it does help to increase the chances of one. Now let's take some time to go through some common questions I hear about egg freezing to better understand this great fertility preservation option. First, what is the time commitment for egg freezing treatment? I often find people speaking about how an egg freezing cycle takes only 2 weeks to complete, and I'd like to elaborate on this a bit further. Indeed, it does take about 2 weeks, on average, for the stimulation and egg freezing steps to occur. However, many treatment cycles are designed with some pre-treatment or priming medication, which can add an additional 2 to 4 weeks onto a cycle. In general, these pre-treatments are not intensive, as they usually require you to take some medications at home, and don't involve the time commitment of cycle monitoring that's needed once stimulation medications are started. But I would say a complete treatment cycle may be as short as 2 to 3 weeks, but is often closer to 4 to 6 weeks in total. Next question I want to address is, can egg freezing negatively impact my health or the health of my future child? And related to this, will egg freezing treatment affect my future fertility and make me go through menopause earlier? I think these are good questions to speak about, as these are common concerns I hear about. Like any medical procedure, there are some downsides to consider. Key factors to think about include the emotional toll of the process, the time commitment required to undergo the medical workup, as well as the egg freezing process, and the cost of treatment. That said, egg freezing should not negatively impact your health or the health of your future child. Many individuals worry that undergoing egg freezing will somehow affect their future fertility or cause them to go through menopause at an earlier age. This is not the case, as we are stimulating and retrieving eggs that would otherwise die off naturally in the body. To understand this a bit more, in a natural cycle, only a single egg is matured and ovulated from the group of antral follicles that come to the surface of the ovary at the start of a cycle. The rest of the immature eggs die off. But in an egg freezing cycle, the goal is to make use of many of these antral follicles and the eggs that are held within them by using FSH injections to develop and mature multiple eggs at once. Another common question or concern I hear is, does egg freezing treatment and the fertility injections used increase my risk of cancer? I hear this quite commonly from patients freezing their eggs, but also patients doing any type of fertility treatment. I understand the concern, since hormone medications are used to stimulate the ovaries during egg freezing or other fertility treatments. At this time, research does not show a link between fertility medications and an increased risk of cancer, specifically ovarian, uterine, or breast cancer, which is reassuring for patients undergoing egg freezing. One question I hear quite often is, why did we only retrieve 10 eggs when I was told my follicle count was 20? This is a really great question and an important concept to understand when going through egg freezing. Exact numbers are going to vary from patient to patient, but this is just an example. Let's talk about why the number of follicles you have at the start of an egg freezing cycle does not equal the number of eggs that will be retrieved after ovarian stimulation. I think the real question here is, why don't all antral follicles respond to medication and lead to a mature follicle and egg? Let's start at the beginning. Antral follicles are small fluid-filled sacs that each contain an immature egg. The number of antral follicles sitting near the surface of the ovary at the start of a menstrual cycle, so day 2, 3, or 4, is a proportion of the total number of follicles inside the ovary. When the ovary is stimulated during an egg freezing cycle, only some of the antral follicles will respond to the medications and start to mature the egg inside that follicle. The follicle will then grow in size and produce estrogen. It's difficult to predict exactly what percentage of the antral follicles will respond to stimulation, as this varies cycle to cycle and patient to patient. I often see a response rate of about 40 to 50%, but this is so variable and can be more or less than this. Additionally, follicles grow at different rates, which means that when we proceed to an egg retrieval, not every follicle will be mature and have an egg ready for retrieval. For those that do have an egg, not every egg will be mature, meaning one that is able to be fertilized with sperm in the future. So, if we look at the initial example in the question and use these details that I've just described, 20 antral follicles may lead to about 10 medium and large follicles during stimulation, which may lead to 9 eggs retrieved, which may then result in 8 mature eggs to fertilize with sperm. So this explains how 20 antral follicles may result in 10 eggs being retrieved during an egg freezing cycle. An interesting set of questions I often hear are, what happens when I'm ready to try and conceive? Do I need to use my frozen eggs? How do I use my frozen eggs when I'm ready? I often tell my patients that what you do in the future, when you are ready to try and conceive, will depend on how old you are at the time, how many eggs you have frozen, and your fertility goals, meaning how many children you ideally want. Sometimes, after updating your fertility testing, it may be appropriate for you to try IUI or IVF first. Alternatively, you may have many frozen eggs or be much older, and so using your frozen eggs makes more sense. I would say that making the decision about what step to take first and what option is best requires a really good discussion with your fertility specialist. When ready to use your frozen eggs, the eggs are thawed in the embryology lab. The mature eggs are fertilized with sperm, either using a partner sperm or donor sperm, and then the embryos are grown. Usually embryos are grown in the lab until day 5 or 6, but occasionally only until day 3. And then they are transferred, usually one at a time, into the uterus. Another common question relates to age. What is the ideal age I should freeze my eggs? This is an important one. As I've said before, age is an important factor when it comes to fertility for people with ovaries and eggs. Both egg quantity and egg quality decrease with age, so ideally you want to think about freezing your eggs when you are younger. I think it makes sense for individuals in their late 20s and early 30s to think about freezing their eggs. Even though younger eggs are better in terms of quality, I don't think every individual with ovaries in their early 20s needs to consider freezing their eggs. It may be a bit premature, depending on their situation. Pursuing this when an individual is in their late 20s or early 30s helps to balance the benefits of better egg quality with the cost of the procedure and any risk that may come with such a medical procedure. Finally, I'm often asked about egg freezing versus embryo freezing. The question often goes, should I freeze embryos instead of eggs because I heard that it might be better to freeze embryos? I think this is a very important topic to discuss, so you are aware of the pros and cons of each of these. One of the historical downsides of egg freezing was that there was a much lower thaw rate compared to embryos. However, egg freezing technology has progressed quite a bit with the use of vitrification or flash freezing, so survival of eggs after thaw and overall prognosis are quite good now, only slightly lower than embryos. One of the pros of egg freezing is that it gives flexibility to fertilize your eggs with sperm of any choice in the future, rather than being tied to a sperm choice if you do embryo freezing now. One advantage to embryo freezing is that because you are fertilizing the eggs and growing the embryos for a few days, you then know how many viable or usable embryos you have, especially if you do genetic testing on the embryos to know which are genetically normal or abnormal. Unfortunately, you don't have this information with egg freezing alone, which is why it is often recommended to freeze a larger number of eggs, understanding that many will be lost during thawing, fertilization, embryo growth, and possible genetic testing of embryos. One downside to embryo freezing is that in general, it is more expensive than egg freezing, and this may factor into your decision. So there you have it. An overview of egg freezing or oocyte cryopreservation, a fertility preservation option that offers individuals more control over their reproductive timelines and goals. Egg freezing is a complex series of steps, from stimulation of the ovaries and maturing of a number of eggs, to retrieval of those eggs and then freezing of the mature eggs for potential use in the future. It is important to understand the process of egg freezing, when it may be considered, and the different medication protocols that may be used and why, so you can feel empowered to make decisions that are best for you and understand your prognosis in doing so. I hope this episode was useful in allowing you to better understand egg freezing treatment and how it works to help individuals preserve their fertility for the future. That's it for this episode of Fertility Doc Talk. I really hope you enjoyed listening and learning and feel empowered about your reproductive health. If you enjoyed this episode, please remember to subscribe to the podcast and tune in to our next episode.